Wanted to just quick talk to you about what we talked about in the morning blend today. Aaron, you had a injury from Taekwondo. You braced yourself after a fall and fractured your radial head.
Yes.
And you talked about that today. Can you kind of go into a little bit of a detail of what that felt like actually when you got hurt and kind of the process of how you got to meet Dr. Kaplan?
Well, when I got hurt after I got kicked and fell backwards, I finished the fight, and I did not realize it was broken or anything was really wrong at the time. I thought I just jammed it.
Yeah.
And fortunately, I lost the fight, because if I had won, I would have had to fight again, and that wouldn't have worked out so well. So I lost. I thought it was jammed. I went home that night, and my girlfriend at the time thought there might be something wrong because I had a range of motion issue.
Mm-hmm.
But we went to a haunted house anyway that involved a part where you army crawled through it, and that didn't go so well. I was able to one elbow crawl it through, but then the next morning I woke up and it was stiffer. It was locked in almost a 45-degree position, but I still thought it was jammed. So she insisted that she has a healthcare background. She insisted that I go to the hospital and get x-rayed. Sure enough, it was fractured, and she worked for, and still does work for, Dr. Kaplan. So she said, I've got people, they're great, I will not take no for an answer. You're going to see them.
They're good for that, aren't they?
Yes.
So Dr. Kaplan, you got to see Aaron not long after that, and can you kind of describe maybe his injury and what you did for it as far as a fractured radial head goes?
Typically, when people come in to see me for an injury like this, they usually have swelling within the joint, and usually with the swelling in the joint combined with the displacement of the fracture, they have limitations in motion. Mm-hmm. But the easiest way to make the diagnosis is just to get an x-ray. Mm-hmm. So the first thing we did was get an x-ray, which showed about a third of the radius of the radial head was displaced by more than a few millimeters, which predicated the next procedure, or the next thing, which was to realign the bone anatomically so that it could be used in a more efficacious manner. So the next step was to schedule a surgical procedure that involved making a small cut on an outpatient basis on the outside of the elbow and reproducing the normal anatomy of the bone and fixing it with a couple of screws that fit into below the surface of the joint so that they don't impede motion.
Now let me see. You have this. Let me see your scar real quick here. So there's the scar right there. So it's not actually really big. I mean, it's a fairly small scar. So
fairly small.
Is that a common injury? I had heard that a lot of people try to brace themselves, and it is a common injury from falling. Is that what you mostly see?
It is the most common injury in adults,
mm-hmm.
Who fall on an outstretched arm.
Yeah.
In kids, the fracture usually occurs the radial neck, which is the area just below the head. But in adults, it's almost always the head.
Okay. So now you went back to competing after that, after
Yes.
some time off, and strong as ever, and you feel no ill effects obviously from it. So
generally, I forget that I even had the surgery. At first, there was a breaking in period with
right.
it, where it was a little stiff, but now it's just like it was beforehand.